Hello and very good evening from here in Thimphu, Bhutan. It is an honor and pleasure for me to represent Bhutan on this webinar and update the audience and the fellow participants in the webinar on the status of the COVID situation in Bhutan. I hope you can hear me. At the start, I would like to mention here that as compared to many other countries in the region, Bhutan so far has been lucky that we have not had to go into our lockdown mode. So we have been going to offices as normal, as usual. And today as well, I went to my office and I came back fairly late. The government has been advising people to implement work from home as well. And in my office too, we have been kind of implementing turn-wise work from home. To an extent, so far, life has been going on here in Bhutan as almost like we have been doing before this COVID situation came up. But having said that, the government has closed the international borders, so there is no free movement of people, although there are vehicles bringing in essential goods on special with special permission and authorization from the government. So I think that is the kind of the situation we have right now here in Bhutan. And since few days back, the government has made it mandatory for the shops to close after 7 p.m. And that is because we had our some of the first batch of people who completed the quarantine and coming out from the quarantine facilities. So just as a precautionary measure, so government has made it mandatory for the shops in the town to close after 7 p.m. And now I would like to update quickly on the figures. So far in Bhutan, 6 confirmed cases have been detected, and all the 6 have been imported cases. 2 were foreigners, tourists who came to Bhutan. They were the first 2 to be detected, and in fact, the first patient, he went back to the US on a chartered plane way back, and his partner, it was reported in the newspaper that she recovered fully, and she just left 2 days ago on 20th of April. And the 4 other cases are Bhutanese people who have been working abroad in other countries, and they have recently returned to Bhutan, and then as is the usual practice right now, so all the people returning to Bhutan, coming into Bhutan, they are kept on a quarantine facilities, in quarantine for 21 days. And these 4 cases were detected at the quarantine facilities. So out of the 6, total confirmed recovered cases are 2, and there has been 0 deaths so far. In the screen that has been shared, you can see that for a small country, we have set up a number of quarantine facilities, and also quite a number of flu clinics where screening happens. So in terms of the response from the government, it has been very positive, and the people have really appreciated the quick response that the government have come up in containing this outbreak here in Bhutan. So I will not go through all the figures that is shown up screen, and this is part of the daily kind of an update that is given by the Ministry of Health. So that is on the number of on the figures. And in terms of the government's response, um, uh, our Prime Minister, as well as His Majesty the King, whom the people here in Bhutan hold in very high esteem and respect because of his always being there for the welfare of the people. So they have been leading from the forefront, and especially His Majesty the King. He has been traveling around Bhutan, especially in the border areas where the risks are highest. So the government's response, I would say, has been swift and effective. I think the government is able to make such an effective response because of our small size and population, I feel, whereas some of the countries in the region, I think you are because of the sheer size of the population, I think the challenges are of a different scale. So the border has been closed, and now in terms of the advisory, the government through various medium, the government has been issuing awareness messages and on the need to maintain physical distancing. And recently the government has also come up with the app for contact tracing in case community infection occurs. So the government has set up an IT team to work on some of the software applications that can help the government to combat the spread of this disease here in Bhutan. And the team has been located in the tech park where I work. So there has been a lot of such kind of initiatives from the government side. And the health ministry people, I think, have been working round the clock since the detection of the first case. With regard to the public health response, so as I mentioned earlier, a lot of flu clinics and quarantine facilities, and the government prepared places where these patients could be kept, and then treatment given in case there is a larger number of infection occurring here in Bhutan. So once the cases are confirmed, they're put in a isolation ward, which are already prepared and in place. And in terms of the quarantine facilities, they have been set up in the hotels, tourist hotels, because right now the whole tourism industry has gone down. So there many of the tourist hotels have been converted into quarantine facilities. And I think with that, probably I would go to the impact on the economy. So the tourism sector, it is the biggest, the second biggest sector here in Bhutan after hydropower. So tourism sector has really been hard hit. It employs a lot of people. So many of the people who have been working in the tourism sector, they have lost jobs. But I think given this unprecedented situation, which is beyond the control of anyone, many of the companies who are able to afford, they have continued to pay the salaries to their employees. Whereas some smaller companies, I think they had no choice but to let go of the people. So so far, the economic impact has, I would say, yep. All right. So far, I think the economic impact has, I would say, not become really unmanageable. But then the government is really concerned. If this situation goes on for a longer time, then I think it's going to be it's going to be very difficult for a lot of the people who are whose income who are of the lower income group. So the government has come up with a economic relief package, and uh, uh, and His Majesty the King has recently launched the National Resilience Fund, and through that, a portal has already been created, and the affected people, because of the COVID situation, can apply for the welfare scheme, which they can avail in monetary terms. They will get the fund directly into their account for the affected people. And maybe last, I would go to the citizen response. So in Bhutan, one of the most heartening things of this situation has been how many groups of people from various uh, different backgrounds have come forward in a show of solidarity and unity to help the country. So I have been most touched by the farmer groups who have come up to uh, contribute rice and vegetables to feed the people in the quarantine facilities. So this has been very heartening. And in addition to that, a lot of people have volunteers, and some young people have volunteered to do laundry services at the quarantine facilities. And quite a lot of people have even made monetary contributions, funds to the government to help the government fund all these different activities, especially like the quarantine facilities. Mm. And even the quarantine facilities, which are, the hotels which have been converted into quarantine facilities, the hoteliers have come forward to allow their hotels to be used as quarantine facilities. And it has been reported that, in fact, they are not making any money, but, it is out of trying to help the government tide over this difficult situation that the people have come forward.